Welcome to a little discussion about cost-benefit of bariatric surgery. You're probably someone who's interested in bariatric surgery, but maybe there's a skeptic in your life who's raising questions about the cost of surgery and whether it's worthwhile. Okay, my name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I'm going to have some good news for you about the cost-benefit of bariatric surgery. But first of all, why are we even having this conversation about cost as the main question in bariatric surgery? I mean, in medicine, bariatric surgery is just about the only field that's required to justify itself on a cost-benefit basis. Now, there are fields in medicine and surgery that are cost-beneficial, especially fields of infectious disease and pediatrics, but there are many other fields that are not especially cost-effective. I'm thinking about cardiovascular care and much of cancer care. And these fields are done, or they're employed without question, because they are the right thing to do, and I think that's awesome. They are judged on whether the risk is worth the benefit of the surgery, and cost only comes into it as a later consideration. And this inappropriate cost barrier doesn't just apply to surgery, but the whole spectrum of obesity disease management faces access problems due to cost. And I think that the obesity disease is treated differently because of prejudice against those who suffer from the obesity disease. There's this old school thought process about obesity as a choice, which somehow implies that people who have the obesity disease have made a bunch of wrong choices. The fact is, and I've presented this extensively elsewhere, that what we're dealing with is a genetic hormonal imbalance that's not their fault. But nevertheless, obesity as a choice still holds sway among many financial decision makers and in society at large, and it leads to the opinion that people with the obesity disease don't deserve to have society help them treat this disease because it's somehow their own fault. It's a shame. Now that I've vented a little bit, I'm going to calm down and we're going to get back actually to a balanced discussion of the cost-benefit of bariatric surgery. Even though I think we shouldn't have to have this conversation, bariatric surgery does come out ahead on cost-benefit, and that's on two levels. That's on the level for you as an individual, your own cost-benefit, and the cost-benefit for society as a whole. Let's be practical. You may have come to this video because you're actively considering bariatric surgery for sustainable health, and maybe there aren't any financial skeptics in your life, but yet money may be a problem, and money's real. Don't be embarrassed, and I have complaints about money on a societal level, but on a personal level, we need to work with this. I mean, maybe you have a large copay. Maybe insurance isn't covering for you at all, and I'll come back to that later. Or maybe you can pay for the surgery, but it's a stretch, and you're asking yourself appropriately, is it worth it? And yes, obviously bariatric surgery costs money. We're going to fully acknowledge that. But here's the key point, and this is something you probably already know, but I want to give you clear language for the doubters in your life. The balance we're talking about here is not the cost of surgery versus zero cost. It's the cost of surgery versus the cost of going forward with this continued obesity disease and its cost. And I'm here to tell you that on an individual basis, people who have bariatric surgery for the obesity disease, they start having lower cost at less than 3 years after surgery. And that payoff at less than 3 years doesn't even count the fact that very often within the first 5 years of surgery, people who have the bariatric operation get promotions at work or change jobs to a higher pay. So they're paying less and they're bringing home more. Why the promotion? So it looks like obesity prejudice holds people back at work, just like it holds people back in other areas of life. And as the weight comes down, the obesity prejudice is kind of eliminated. It's very frustrating that it has to be done in this way. Really, we'd like to fix society as a whole. But if we can get you as an individual past this, then your talents can be recognized and you can start making the pay that you deserve. So basically, less cost over time, less healthcare cost because of less disease, lower weight, better health, and better income is quite likely, not guaranteed. And so the cost benefit is hugely positive. And by the way, people who have bariatric surgery typically live longer and healthier lives. That's going to be the subject of another video that's going to be about the health benefit or the health risk balance of bariatric surgery. The professionals who do research on healthcare costs are called healthcare economists. They've been researching bariatric surgery for more than 20 years, and the reports that they produce have routinely shown that bariatric surgery is cost-effective on a societal level. In fact, the cost-benefit of bariatric surgery for society as a whole is improving as bariatric surgery continues to experience reduced risk with reduced cost, and better long-term outcomes with longer sustainability of reduced healthcare costs and quicker return to work, so better productivity gains or less time out of work. Now, these positive findings hold true even though much of this research is being done in large university settings where costs tend to run kind of on the higher side. The good news is that if you're a person who's not very sick with your excess weight at this time, then you're going to have an option for having your bariatric operation in a small bariatric surgery focused facility where there's lower cost, still with very high quality and very high service. And I'm not talking about going to Mexico for your bariatric operation to save money. I hope you'll forgive the wardrobe change. I know it might be disorienting, but it's a different day, and I realized I left out some important points about those research studies. One thing is that those research studies are mainly covering healthcare costs around bariatric surgery, positive and negative, and they're not looking very much at individual personal costs or what's coming out of your checking account. And this is important because patients often tell us that they save hundreds of dollars a year on grocery expenses and restaurant expenses after their bariatric operation. I've already mentioned that patients often bring home more money through promotions and better job opportunities, as the obesity prejudice fades. In transparency, I will say that especially in the first year or 18 months after surgery, patients often spend more money on clothes, but that can be kind of fun. So those are some additional perspectives on the cost aspects after bariatric surgery. Going back to the aspect of insurance coverage for bariatric surgery, in the US, insurers are not required to cover bariatric surgery, and most often bariatric surgery coverage happens at large companies. Furthermore, it's at large companies who have recognized the benefits of investing in bariatric surgery for the long-term health of their employees, and places where those employees at some point have stood up for themselves and said, hey, we deserve this coverage, we want this to be a benefit on our plan. It's no surprise that the large employers who do implement insurance coverage for bariatric surgery achieve a healthier and a more productive workforce, as well as lower healthcare costs. So it's a win-win-win all the way around. And we really can extend these benefits or this win-win-win calculation to society as a whole, which is one of the points of this video. Unfortunately, there continue to be many large employers who could, but who don't cover bariatric surgery. And this might be from prejudice in some cases, but I think more often it's related to just institutional inertia and failure to update policies for modern times. I do think there's a place for activists within these companies to declare the need for bariatric surgery coverage and perhaps get some of these policies updated. And if you work at a small employer that has, let's say, less than 50 employees, it actually really is hard for that employer to get bariatric surgery coverage. And this is because even though bariatric surgery complications are rare, they can be pretty expensive. And when you're talking about small groups or pools of people on the insurance plan, that causes significant risk distortions that make it hard to implement a coverage plan. Thinking about larger insurers, which is kind of the third player in this. There's large employers, there's small employers, actually four. There's people, and then there's the insurance companies like Blue Cross and Aetna and United Healthcare. And the obesity as a choice paradigm still holds an unfortunate degree of sway at the large insurers. There's this persisting opinion that people who have the obesity disease should take care of it on their own, and that's pervasive throughout society. And so that means that the insurance company policies lean away from coverage. It's not that it's completely eliminated, but they don't want to cover it. And so in our current generation, society is kind of throwing the cost for bariatric medical and surgical care back on the patient. As we've said, I think that's not right. I think change is going to be very frustratingly slow. It has been slow. And I think that change isn't really going to happen until society overall discards this outmoded obesity prejudice and obesity as a choice thought process. I hope we'll get to a point as the generations turn over where obesity disease is understood to deserve the same level of treatment as cardiovascular disease. So the fact is that getting insurance coverage is not going to be practical for a large percentage of people who need bariatric surgery. That's the bad news. The good news is there are still options. As I'm recording this here in South Texas, a bariatric surgical procedure costs 1/3 as much as a new Ford F-150 pickup truck. Now I'm in Texas, so I think in terms of pickup trucks, but we could make the same argument for a Honda Accord in the upper Midwest, etc. So the smart money sees bariatric surgery as an investment. And yes, there is an upfront cost. There's not just the dollars out of your bank account, but there's the time away from your family, time away from work, etc. But I hope you can see the payoff is closer than you may have thought. You deserve a long, healthy life. Don't let anybody talk you out of that. And yes, the money challenge is real, but I hope you can see maybe it's not as steep as you thought. Best wishes.